Let's talk about how body structure and posture can affect kidney and bladder. Hi, I'm Dr. Peter Minke. This is Minke Wellness. And we've talked about, we're going through the body systems and we're now at the elimination system. There are definitely the postures and ways we sit and things that we do to our body that can affect the kidneys, which are up in the low back. I'll show you that in a minute. And then bladder separately, because the bladder sits in the core, and so loss of core tone can cause the bladder to fall. And if you're in that sneeze and pee scenario where if you sneeze, you're worried about dribbling, then you don't have enough tone to support the bladder. If you have prolapse in your bladder, then that's a problem. So let's talk about those two things. They're obviously somewhat separate things. Core tone, loss of core tone, and we'll talk a little bit more about that in a minute, but loss of core tone or weak core can have an effect on both the kidney and the bladder. But there are some specific things about how we sit and the position of our body that can be affecting the kidneys. So let's talk about kidneys first, and then we'll go to core tone. I've already done a video on core tone that I'm going to make. I'll put a link in here to that. But let's go. So I'm going to back up, which means I'm going to have to kind of yell at the video camera. But I'm going to stand up, which means most of my head will be cut off. But so in this position here, actually you might have to tip it down a little bit. If we look at the position of the pelvis, okay, the pelvis, if the pelvis sits level, I'm kind of here compressing the low back, the pelvis should be slightly tilted forward, and that puts me in a situation where I'm kind of even front to back, and the weight of my body is in my arches and slightly in front of my heels. But if my pelvis is rolled too anterior, right, so if I tilt even further, then I get this compression across the lumbar. And you see people whose pelvis is really forward, and sometimes there's a belly associated with this, right, where they're way out here, and then the chest is back and down. And so you see these people whose standing posture is like this, usually not this severe, but sometimes you can. Well, this is really going to impact the kidneys, which sit right back here in the back. So as I walk, every step I take, you can see I'm just, all the weight of my upper body, chest and head are just jamming right down into the kidneys and just really doing a number on that. So some of that posture is sitting at a desk. You can kind of see how that, let's see if I can get this. You can see how sitting at a desk, and just kind of lounging back would generate that kind of shape, right? And so here I am just kind of down like this, especially if I have a chair that has a lumbar support. So here I am rolled over the lumbar support, but my chest is still sitting in the scooped out back of the chair. And then I'm doing this number and doing the mouse and whatnot. So that's one scenario that I see happening with a lot of seated posture. That's one of the biggest ones that I see with loss of or impacting the kidneys is this position of the chest sort of back and down, and the weight of the chest going straight down into the kidneys, and that can really put a lot of tension. I've mentioned already in previous videos how we really want the organs to be loose. They need to move, they need to be sliding over their neighbors. It's really not good for the kidney to be attached to the colon, because every time the colon goes through a contraction, right, which it's doing a lot with the peristalsis, then it's sitting here pulling on the kidney. And so these things are supposed to freely move between each other. So if the colon, just slides right on by and doesn't interrupt kidney function and pull on the kidney every time that thing. So there's a lot of things like the rectum for women, the rectum and vagina can get adhered, and that can obviously create problems with intimacy. Then we have also in men, the prostate and the rectum can get adhered. And so these are things that these organs are supposed to slide. The more problems we have, structural impacts. This is car accidents, high G. They don't even have to be. All car accidents are high G, high gravity. A lot of force moving through the body. It doesn't even have to be a severe car accident, and you can get your organs jammed. And so, really do need to look at getting organ release work done. It's usually called visceral release. And it's a great system. You can get that done. Most people who are trained in craniosacral therapy are familiar with Visceral Release, the Upledger system has training in Visceral Release and Aston Patterner. I'm a certified Aston Patterner, and we have training in advanced Visceral Release as well. And so there's a lot of bodywork systems out there that can help to do the gentle work it takes to release the organs and try to get them to soften and try to get them to move. There needs to be that fluid interface between the organs, and definitely the kidneys are included in that. So that's a big issue with kidneys and any of the organs, but kidneys in particular. They're in the back. When we get these hits, that especially if it's a car accident, hitting from behind, or actually from any direction, really. I mean, because you get hit from the if you hit someone in the front, you pull against the seatbelt. Any of those jarring actions, even minor car accidents. A lot of people say, I will have on my sheet intake. I say, have you ever been in a car accident? And they don't check the box. And then I'm talking to them, so I say, have you ever been in a car accident? Oh yeah, a couple, but they were just minor. I said, well, what do you mean by minor? Well, a little fender bender, so enough to bend metal. Yeah, oh yeah, there was a crunch in the door. Well, that's, I'm talking about a minor car accident is when you back into the, your mailbox. That would be minor, okay? But if there's a car, you against a tree or enough to bend metal, that's a significant impact to your organs, okay? So if you were, in other words, if that was just you impacting that, you were running along at the same speed, say, oh, it was only 10 miles an hour. Well, you go run at 10 miles an hour, run into a mailbox or another car, and tell me how you feel at the end of that. So what I'm saying is you're hitting that seat belt at 10 miles an hour. That's a heavy impact. So obviously the 50, 60 mile an hour, 80 mile an hour, 100 mile an hour collisions are far worse than that. So please get some massage or body work if you've been in a car accident, which unfortunately is most of us. So now, that being said, I want to switch gears into core tone. And you'll hear a lot about this. A lot of people talk about core tone. And I'm going to refer you to the other video I did on core tone because I talk about how to sit and stand. But let me give you the basics. Most chairs are horrible for your core. And they're designed with this idea. I'll scooch back here so you can see this. They're designed with with us sitting too low. And we sit here with our pelvis tucked back, and we sit in this little hole, and then our back is scooped out. And basically, have you looked at airplane seats? These are horrible, right? You're sitting like this. The organs have no support whatsoever. Everything's just sitting out there. I have no way of actually toning from below. My legs are left out of my entire tone support system, and so there's no way for me to get anything. So when I sit, I should not lose. I really should have the same torso. My torso should have the same integrity sitting as I do standing, right? So this shouldn't change. The dimensions are all around here, right? So the dimensions in my torso here shouldn't matter whether I'm sitting or standing, right? This should be basically the same dimensions, same shape. And so you need to be looking at the way you sit and make sure you have that support that you need. Most of the time, it's just how this chair is designed, and you sit down in this hole. You got to fill that hole with a cushion. You can get these wedges. Judith Aston sells these wedges on AstonKinetics.com. I'll try to remember to put the link on that. And you can look at getting these chair wedges that fills the hole and gets your body to get some core tone. Let me say this about core tone, because you go to the gym and a lot of people talk about, I go to the gym, I do core. Yeah, oh man, I'm doing core workouts all the time. And I come in and they lay on my table and I do an assessment, and they might do a core workout at the gym, but when they walk, they don't use their core. So if you don't use it every day, I don't care how much you work it in the gym, it's not doing you any good anyway. You're not using it in your daily actions. On the flip side, if you use your core when you walk, you don't need to go to the gym to tone your core because it's toning all the time you're working it. Okay. So we've got this dichotomy problem here. Is like in my experience, in my practice, people are saying they've got core tone, or they're doing these core workouts, and I'm touching their body going, there's no core tone here, or there's very, it's very sporadic core tone, a little almost overtoned on certain muscle fibers and just nothing on certain other muscle fibers. It's not integrated. It's not complete tone. I can tell that they're working some of their core, but overworking some fibers and not the others. So it's a very challenging scenario. But that's so important for bladder all the organs, everything's falling out. So if you, as a woman, if you've had a baby, definitely if you've had C-sections, any of those kind of abdominal surgeries, any guy, anyone, either male or female, if you've had hernia surgeries or appendix or any of those things that puncture down into the abdomen and cut into muscle down there, you're going to have trouble with core tone, and you need to probably work on those things. So the core tone really requires a proper use, proper biomechanics, and I go through that video on sit to stand. Highly recommend you watch that, because I actually go through that process of how to think about core tone, how to get core tone from sit to stand, and how to push that from below. And you remember from the beginning, go back to the very early videos, we talked about getting some tone by pushing from below, and this idea of a nudge. Right, go back to our nudge video. I've got all these links I got to put on the video now. And we go back to that nudge video, and you go push, 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 and we're getting tone coming up now. There's also the Kegel exercise, and I go through that in that other video. So these are exercises that you need to really get a handle on. Start doing them on a daily basis. It doesn't have to, you don't have to kill it. I mean, like 15 times a day, although that would be good. But even if you just did it twice a day, 10 reps twice a day for some of these simple exercises to get the core engaged, it would help. If you're working it and it's really not helping, then you probably need the hands-on work to someone to come in and get scar tissue released or get some of these structural restrictions released, so that you can then use your exercises as maintenance. There's a lot of times when exercise is not going to make this enough change to get you where you need to go. Okay, so I haven't mentioned anything about Raindrop Therapy in any of these structural things, but I'm going to just make a little tag here for Raindrop Therapy, and if you don't know what that is, we'll probably have to do, I'll probably do a short video on that. But Raindrop Therapy is basically a hot oil, I call it a hot oil treatment on the spine. You put oils on the spine. We always use a hot wet towel. I know that's not taught anymore. Back when Raindrop Therapy was originally taught by Gary 20 years ago, we all used a hot wet towel to push the oil deeper into the tissue, because you know that oil will go away from water, so they're fat soluble, and they go into go away from the water. So when you put a hot wet towel on, it really pushes the oil deeper in. So we'd put the oils on the spine, do little strokes and things, just to help the nervous system relax and the muscles relax, and then we'd put the hot wet towel on, and you just kind of soak, and we actually would get some nice, relaxation of the spine, and you could feel yourself being able to stand up straighter, I think it's reasonable to believe you could use some massage combined with some essential oil treatment, this topical treatment of enhancing the massage, to actually get some change in posture that would be, not so down or compressed or whatever. You start to get a little bit more movement there. So that's something to consider. And write me a comment if you're not familiar with Raindrop Therapy. Maybe I can do a video on that. Like I said, this video, I'm making a whole list of things I need to link in there. So okay, so this is just an overview discussion. I'm not expecting you to get all the answers from this, but just to begin the dialogue and to look into some things that you might be missing in your wellness journey. You say, gee, I've tried all these things. I don't understand. I'm doing this butt buster workout. I'm doing this core workout, and I just don't seem to be getting the benefit. I think I'm doing a Kegel, but am I doing it correctly? Those kind of questions, and I can help you along the way on those things, because that's what I do every single day. That's my main day job, is to work with people structurally and help them move better and get aligned. And that's something I've been doing that for 20 years as a certified Aston partner. So I know I have a lot of experience with this particular issue, and I have there's a lot of stuff out there that's just not correct. And I hate to be so right about some things, and I don't claim that. Judith Aston of Aston Patterning, I learned from her. But sometimes you hit on something and you know it's right, and this is the real deal, and the establishment is too obstinate to make some changes. So a lot of things posturally and ergonomics are just not quite right, and then we need to make some corrections there. So look into the Aston Patterning work for some advice, and Judith Aston's videos on how to get your ergonomics set up straight for your desk and things like that. She also has walking videos and things like that. Awesome resource. Go check those out. Happy wellness, one day at a time. We'll see you tomorrow.